Hello, everybody. My name is Matt Kern. I'm here with Amy. Amy, how are you doing today?
Doing great, thanks.
Doing well, good. I'm so glad that you're on the show with us today and on this 108 Challenge Summit where everybody is watching you. So tell us just a little bit about yourself and what brought you to work for Drug Free America.
Great. My name is Amy, and I've been with Drug Free America for about 12 years, almost 13. And we're based here in St. Petersburg, Florida. And I came actually from a drug court. So here in Pinellas County, we have a really large drug court where we link defendants, both juvenile and adult, with different treatment services in order to keep them out of jail. And before that, I worked at a juvenile treatment facility. So I've kind of been in this drug world for all of my adult life,
Yeah.
and I landed at Drug Free America Foundation because it gave me the opportunity to work both in the prevention field, but also in the drug policy field.
Oh, wow. So if you're explaining to the audience today that's watching, what is the mission of Drug Free America? What exactly do you guys do?
Sure. So Drug Free America is a drug prevention and drug policy organization who's committed to developing strategies that prevent drug use, but also promote treatment and sustained recovery. So our mission, kind of a blanket statement, is just to rid the world of the burdens of drug abuse. And, our vision is a world where all people live free from that burden.
Yeah. And so we all know it's a big burden, right? So how, if you're looking at it from what guys doing from a data standpoint, from a policy standpoint, how big of a problem is this within the U.S.?
Oh, it's huge. And it's not just the US, it's
Yeah.
global. So one of the great things with Drug Free America Foundation is we are a non-government organization that has special consultative status with the Economic and Social Union of the United Nations. And that's a mouthful, but what
Wow,
that
that is.
means
Uh,
is that we get to work on this issue at the global level as well. So we like to think, like when we talk about things at the UN, we talk about thinking globally but acting locally. So looking at what's happening at this global drug epidemic, and that's what it is. It's everywhere.
yeah.
Um, how can we take what's happening at the global level and bring it down to a community level so that we can make positive changes? And a lot of that is providing the data. One of the things that I hear all the time from our youth is that they believe that everybody's doing drugs. We put these surveys out there every year. We ask kids in school to complete these surveys, but often we don't tell them the results of the survey. And the results are that the majority of people don't use drugs.
Yeah.
So even though the perception is that everybody's out there doing it, the reality is if you're not, you are the majority. So
Yeah.
how do we lift up that majority, and what can we do to help them, really showcase all the great things that they're doing by not using drugs?
Well, that's actually interesting to me. So how do you do that? How do you get that message across? What's the message that you try to push?
I think that it's just a message of positivity. So instead of always talking about the problem, let's talk about some of the solutions. Let's talk about the great things that youth are doing. So instead of saying 17% of 12th graders in this high school have used marijuana once in their lifetime, let's talk about the larger percent that never have. And let's showcase some of the activities that they're doing. I love hearing from youth and hearing about the things that they're doing in their community. It doesn't have to be anti-drug related. As long as you're not using drugs, guess what? That's anti-drug. So
Yeah.
if you're going out and you're being a peer resource for kids that are younger for you, you're making a difference in somebody's life. If you're going to help a veteran out who can't maybe do his yard work or can't grocery shop, and in a time like this where we're all so disconnected, if you're that link that's connecting your neighbors by just saying hi and sharing hope and joy, you might be making a huge difference that you didn't even know that was happening. So it's just lifting up people who are doing positive things, which is the majority of youth today.
Yeah, I think you're right. So I have three kids. I have a son who's 23, a daughter who's 20 at UNC Chapel Hill, and I have a 16-year-old daughter who's still in high school, right? So I truly believe in your message of what y'all are getting out because the good that people are doing, and I'm a veteran, right? So you hit home with me right there about what are the great things, and there's so much positive that our youth they're doing today. They're out there making a difference. All of our youth are a lot of times are involved in those service clubs. So what can the service clubs do to make a difference? And I think that that's just a great message that y'all have.
Absolutely. Yep.
Yeah. How did you get to know Eric Burgess and the 108 challenge?
So it was actually just through, and that's the great thing about community outreach.
Yep.
You know, once people learn what you do for a living, especially when you're involved in the drug world, everybody has a story. And like I said, I've been in this for a couple decades now, and it used to be that I would tell people what I did, and sometimes they'd have a story, but most of the time it was just like, oh, that's great. Now you can hardly get the word drug prevention out of your mouth before somebody is telling you, oh, you know, my neighbor's child, or I lost my loved one. I mean, everybody is so connected. So one of my husband's colleagues grew up with Eric and
Yep.
knew Eric. So when she found out what I did, and we had been talking, and I guess Eric had reached out to her, and she connected us both. And she's like, I don't, you know, I know you guys are both kind of in the same field, but I'm not sure how this works, and I just want to put you two together. So we had a great conversation on the phone, and I invited Eric to come out last year. Each year we host a huge drug prevention summit here in the Tampa Bay area,
Yep.
and he came out to our seventh annual, I believe it was, and he told his story about the 108 challenge and his story of recovery. And we just like to hear stories about that, because when we do our prevention summit, it's a train the trainer. So it's a
Yep.
lot of professionals in there. And sometimes we get a little overburdened,
Yep.
and we kind of lose our focus, and we you know, we wonder, why are we doing this? There is that sense of hopelessness
Yeah.
sometimes. And then we hear a story like Eric's, and we know, we remember why we're inspired to be in this position. And you know, if his message, or if us bringing him somewhere, if that changes just one person's life, just
Yes.
one person, and has a positive, it was a job worth doing, a life worth living. You know, you change that one person. And I have to believe that after all of this and all these years and all of these things that we're doing, and connecting with groups like Eric's, that we've at least reached that one person, but hopefully thousands of more.
Yeah, absolutely. And his story is so inspiring. You're so right. It's so inspiring, just the path that he's walked. And I remember I had just met him when he was actually getting ready to go down and speak at you guys summit. And he was really excited about it. And he was excited to tell the story about what he was able to go down there and do, and how he was able to speak down there. And I just think it's a wonderful platform that you guys put on. So I have my degree in counseling, mental health counseling and all that. And so I know how hard it is to go through that education piece and just to learn how to be in that situation when you're talking to somebody. So that's one of the reasons I think I've connected so well with Eric, is just to see such a success story. Because we've all been, if you live in that world, we've all been, or we've all dealt with, or had people that we've worked with who are walking that walk and talking that talk. And how can you help them out, and to see Eric, somebody who's going on that path and who's really, staying on that path. And he'll tell you every day it's still a struggle. He'll tell you every day that he's working through that. So that, what you guys do is so, so important. Talk a little bit about that summit. Y'all do it once a year down there.
Yeah, so this was our 8th year, and this year we were so blessed to have the opportunity to have the U.S. Surgeon General be our
Oh,
keynote
wow.
speaker. So we had Jerome Adams was here, and we were just all starstruck. I mean, it was
Yeah.
just to have that. But I have to be honest, every year we get what I call our dream team of speakers, and each year it gets harder because we're trying to outdo what we did. But it's a sometimes 3 day, sometimes 2 day summit, where we provide continuing education credits for people who are getting their prevention certificates, that are in mental health or marriage counseling or substance abuse counseling. And really, it's just to kind of give them an update on current drug trends, an update on new research that's out there, and then also showcase some programs that are working. This year, we had an amazing youth group that came from somewhere in Idaho,
Oh, wow.
and they were talking about what was lacking in their community, when it came to a place where youth could come together. And instead of complaining about it, they made the program themselves. So
Yeah.
there was something out there that was a good fit with them. And they do everything from, game nights to volunteer services. And they do mental health things. They do substance abuse issue things. So they're covering anything that could possibly impact youth today. And they're doing it in just such creative ways. So bringing in groups like that to show what's going on and the different things that you can replicate in your community, we just really feel is important.
So, which is great because Drug Free America, you are really an integrator, bringing different programs, different people together. And that's why it was so important for Eric and for me as Convene to have you guys as one of the main sponsors, one of the main participants in this, 108 Challenge Live event, because we know how important it is. It takes a village, right? It takes not just, one organization or Eric over here and Drug Free America over here or Steered Straight with Michael Daly on here. It takes a whole village like that school, right? So we really appreciate you being a part of this. And so how can we work together better? How can we build a community? That's a leading question, right? Because we're talking about convened communities, and one of the communities is Convened Hope and Support. And the whole purpose of Convened Hope and Support, led by Eric Burgess, is to bring together all the resources that we possibly can in one spot, as well, not just one spot, but in one place that we can all work together.
Absolutely, you have to do that. And it really it amazes me that every time I go out into the community, there is a lack of understanding of what is out there and what resources are available.
Mhm.
And that's a shame because there are so many great resources that are going untapped and unnoticed and unused.
Yeah,
And we are just not big on recreating the wheel here.
yeah, that's right.
Usually when we think of something, we're like, oh, we have this really great idea. We just Google and find, oh, well, somebody else had that great idea. Let's look and see what they're doing. Let's talk with them. Let's work with them. Let's see, is there a piece of their puzzle that's missing that we can maybe add to? But having these, especially community coalition meetings, I guess,
Yeah,
for a lack of a better term, and really showcasing what's out there, especially right now. And one of the things that I know that you're going to be talking about later on in the show is telehealth.
yeah,
And I think that right now, now more than ever, such an important resource. I learn more about that every single time that I speak to these people about these different services. And I just think that it's such a key component to what's going on right now to link people to people that their services might have been discontinued because they can't get out of the house.
yeah.
Also, what a great opportunity to reach people who haven't started that yet, who might have been a little uncomfortable with going to a group or letting other people know that they needed to speak to a counselor. Now you have this opportunity to do it all virtually and really kind of dip your foot in that pool and see if it's for you and get the help that you need. So it's pretty cool.
Yeah, and that's one of the things that I want to bring up about Convene that is so important is that there is anonymity to it. So anybody and everybody, like we don't want to share our dirt when we're going through something that is, depression or drug addiction or some sort of addiction. It doesn't always have to be drug or alcohol related. It can be anything. Well, maybe we want to reach out and get some help, but we're scared. We don't want to put ourselves out there. So one of the things that we do within Convene is there's people that come in and write experiences about their battles with depression, their battles with alcoholism. Well, they have the opportunity to do that as themselves, or they can do it anonymously. When people are responding in the questions, they're doing it as themselves, or they're doing it anonymously. They're doing it anonymously. When they get to the discussion boards, they can do it as themselves or anonymously. So it's so important just finding a way that we can all reach out and help, because there's a lot of good organizations out there, a lot of good expertise out there. That's what they're there to do. They want to help. They want to be a part of this growth process to really help you through.
Absolutely, and we can't do it alone. Drug Free America can't be the only organization out there that's advocating for sound drug policy
Yeah.
or that developing prevention materials. People see us coming from a mile away and they're like, oh, it's the drug prevention people. But when we come with a whole bunch of other groups who have the same mission, they might not even be an anti-drug coalition. It might just be a group of volunteers, or better yet, a group of students. I mean, nobody listens more to what we say than when we bring a group of youth with us,
Yeah.
because that's who people want to hear from. So when we can engage our youth and when we can give them the information that they need to digest, to talk about this at their level and in their own words, that's what makes change in our communities. So it's empowering different groups, especially our youth groups.
Well, Amy, I couldn't have summed it up any better. That was wonderful the way you just ended that, because that's what we're trying to do. Trying to bring together our youth. We're trying to bring together those organizations that are here to help others. And Drug Free America is leading the charge. So I could not uh, appreciate you more or say thank you enough than being a part of the 108 Challenge Live, speaking on behalf of Eric Burgess and myself. I really thank you for being a part of this.
Well, thank you. It really is an honor for us. We're really happy to be here.
And tell everybody real quick where, if they want to go find Drug Free America, where can they go find Drug Free America?
Super easy. It's www.dfaf, as in Drug Free America Foundation.org.
Okay, that's good. And hopefully we'll have a group with Drug Free America and convene soon, so that where we link it all together. But Amy, thank you so much. It's been wonderful, and I really appreciate you. Thank you.
Thank you. Thank you.